Welcome to Your Health in Your Hands. I'm Dr. David Ajibade with the Brain and Body Foundation. Now, World Sickle Cell Day is coming up in a few weeks. And as you know, Nigeria is #1 in the world when it comes to sickle cell disease. So whatever solutions, whatever breakthroughs that are to be made should be made, in collaboration with or should originate in Nigeria. And yes, I know the US is doing a lot of work where that is concerned, but they only have a fraction of the cases of sickle cell disease that we have in Nigeria. And our cases, as you may know, are much, much more severe. Our goal with the Brain and Body Foundation is to reduce the death rates of children living with sickle cell disease below the age of 5 from what it currently is, which is about 50 to 75%, to less than 10% by the year 2025. Now, I know that's a tough goal, a very lofty one to reach. And maybe we should have extended it a little further. But we have done a lot of work. We've done a lot of work with research. We've done a lot of work with charity. We've developed and formulated supplements and nutritional formulations that can help children at whatever age they are and that are safe and effective. And so we thought that today, for this episode, we want to talk with one of our superstar doctors, one of our doctors who has been leading the charge at our foundation, working directly with these kids and documenting the results. He has a special interest in sickle cell disease. We'll get into that in a minute. But let me just say, welcome to the show, Dr. Clever. How are you, sir?
Very fine, sir. Thank you very much.
Well, we certainly appreciate everything that you've been doing for the kids at the foundation. And how long have you been volunteering with us now?
I think 3 years.
Wow, it's been that long, 3 years. Okay.
Yeah.
All right, cool. All right, so can you tell us what drew you to us? I know you have, like you said, you have a special interest in sickle cell disease, but can you just give us a story about how this all started and what your interest in sickle cell disease is?
So my interest in sickle cell, growing up, my dad is a doctor. Growing up, I've seen a lot of people with sickle cell. Like, I didn't have much knowledge on that, but I've seen a lot of people with sickle cell who most times get ill-treated, they get abandoned by their family, they get intimidated by their friends, they get the way other people treat them like they are outcasts, and it feels so, like, seeing them, like, I watch them most times, their reaction, most times when they're crying, that nobody takes care of them every time they're sick, and their parents who are always saying that they're waste of how would I say, like, training them is a waste of resources. So I knew most of the parents. Some of them I got close to because of my dad's influence. So some of them I got close to them, their parents. So I asked them questions. This was when I was younger, before medical school. So most of them I asked them questions like, okay, what is this sickle cell? What do you know about sickle cell? I don't know much about it, aside the normal, when they get to 30 years, they will stop having crises. Those are the myths, like they die at so age and all those things. That was what every of them knew. So when I think in medical school, I met someone who we got together, we became friends, we got dating, and she was sickle cell. And same thing I knew when they were little was the same thing she still knows, even as an adult. So I was like, nah, this is not supposed to be so. So now most times she feels so sad. She's always depressed. Like, she just wants to waste her life, and more like, I don't have much to live for. So I mean, let's just live and die. Do you understand? So I believe that I believe that there was so much to that. Sickle cell does not mean that you will die at so age or stuff. So I had to go, I had to now put interest. I was like, okay, I have to study sickle cell very well. So I will educate these people that they don't get to an age to die, or their parents are not wasting money on them, and tell some of their parents that they can actually send these children to school. The money is not being wasted the money is not being wasted. It's actually an investment. Sickle cell children can do anything they want to do. Like, they can be doctors, they can be engineers, they can be pilots, they can be whatever they want to do. Like, so explain, they make these people know, because in my place, they think that they are Obanji. I know what Obanji is here. So some of them they
Yeah,
think
but
they are
please
Obanje.
explain
They
that.
think that, eh?
Please explain that.
Obanje is like most of them they think they are reincarnation of maybe a forefather or a great grandfather who came to torment them because of they were angry in their past life or whatever. That was what they believed that. So this person has come back to torment them, to make them go through pain and all those things.
Yeah, yeah. And so there's that education that you need to break those false beliefs, those cultural
Yeah,
indoctrination, so to speak. And I know in the Yoruba land too, I says one of the terms they give to people with sickle cell disease is abiku. That yeah,
Abiku, yes.
they're born just to die.
Exactly.
And as I mentioned earlier, the statistics is that over 50%, some say as high as 75%, will die before their fifth birthday, and that's over 100,000 being born over 100,000 deaths every or 75 to 100,000 deaths every year of kids below the age of 5. So that's absolutely unacceptable. So you guys you were, I guess we can say you were sort of impressed. You saw the results that probably had you seen these results before in medical school or as a practicing doctor? Let me ask that.
No. What I was doing before was just education. So just the normal, yeah, they have to go through pain. So no, I've not.
All right, so why don't you tell us a little bit of some of the results, especially the ones that impressed you the most?
Okay, I mean all of them impressed me. I'm never going to lie. All of them actually impressed me. Yeah, because with
Okay, which ones stand out the most? Let's put it that way.
yeah, I have a patient. Like I cannot remember most of them their names, but I know one Hafsat. I think the mom still calls me. Aside Hafsat, there's someone else that goes to my church. I brought to PPF. So these people, whenever they come, like before they came or before I met them, their crisis was always like whenever their moms are complaining about it, you will see the pain in their you see the pain in their face, even in their you hear it in their tone where they're tired, they've spent money. I had my friend, one of my friends who I brought here, her siblings for over like 10 years or so. She says she spent all her salary on treatment for her siblings. And whenever they go to the hospital, they just treat them with like normal, give them anti-malaria and stuff. And she says she complains that she earns money and she spends that money on treatment on her siblings. She doesn't use it for anything. So a couple of them stood out. I'm talking about people that are close to me that actually brought to this place. So the ones I was monitoring closely, aside the ones I met here. So during the course of coming to this place, doing their treatment, I call most times in between to check in on them. They will since from the time they started taking that, in short, whenever I call them, they just start with doctor, God bless you, God bless you, God bless you. So I mean, someone you call to check up on the person or the person in charge, the person starts praying for you, telling you God bless you and all those things. I mean, you don't need so much. Yeah, you already know what's happening. You already know what they're telling you, God bless you. You already know that this you've not had crisis, the babe has no longer, she's no longer spent. Like it's been a long time she spent money she actually earned from working on herself. Like she doesn't spend much. They don't go to the hospital for every time. Like they don't go to the hospital always again. They don't even since they've not even gone to the hospital. I have one again, Hafsat. She has not had crisis right from the first time she had come to Kobo General Hospital. I just met her in Kobo General Hospital. She has not had crisis from that time till yesterday. Like they've been with us for a very long time. I think for a while, like up to a year or so. They've not had crisis
Was
till
she having
yesterday.
crisis regularly before?
Yeah, it was so she and her brother, it was so terrible. It
Hmm.
was so I believe I'm talking about the people that their parents told me that their case were so terrible. Like every time they spend money in the hospital.
Can you tell us, for some of our viewers who may not be familiar with sickle cell disease, can you give us an idea of what these kids were going through? You've said, explain what the sibling was going through and having to spend money on taking them to the hospital. But what does a crisis actually look like in these kids' cases?
Mm. Now this crisis, I don't it's you can't explain the pain. I won't even lie, but it was really the joint pains were so excruciating that these kids cry, like they're always crying, they're touching their knee, they're touching their joint, they're always crying. Pains are so crazy. Like a lot,
Hmm.
like someone was giving an analogy one day. She was like period pain with labor pain. It's not even compared. It's not half of the pain the sickle cell patients experience. Then I know labor pain is really crazy at some level. Period pain too is really, really crazy. So imagine when these two pains is not even close to, it says not close to a pain, it's because the patient is having, that means it's out of the route. It's really, really crazy. Really crazy. And some of them feel like they actually want, like some of them say, the ones that can talk, the ones that can express their feelings, they'll be like, I just want to die, I'm tired. Because it's stress, it's painful. Like imagine going through that thing every week. Well, imagine when you're even going through it every day, like 3 times in a week, every time you're going to, and they want to take you to the hospital. Then let's imagine those of them that can't even pay for hospital bills, like they cannot pay to the government hospital. Some of them that come to the hospital can't even pay even their transport to come to the hospital. So someone that cannot pay their transport to the hospital, how does she or he want to pay for admission in the hospital? So the pains, it's like it's something you can't even ignore or stay in the house. But it's crazy. It's crazy. It's so. I can't. You can't explain the pain of sickle cell. Even them, they can't explain the pain. But it's something that most of them wish to die when they're going through that pain. A lot of them wish to die whenever they're going through that sickle cell because that crisis is a crazy thing.
Yeah. That's the sad thing about the whole situation, and that's just part of it. One thing I discovered when we started working with kids with sickle cell disease, that the crisis is one thing, right? So the crisis is an acute onset thing, and it's like it lasts maybe an hour, some people for days. But there are many others who, even on top of that, or behind the scenes, they are living with ongoing chronic pain that does not reach the level of a crisis, but they're having to deal with it nevertheless. And I didn't really appreciate this until there was this mother. She brought her son. I think he was like 4 or 5 years old. We had given them some nutrients to go home with, and then when they came back, the mother was like, "Yeah, nothing, no real." She didn't really notice anything. But as she was talking, I was looking at her son, who was just goofing around. I mean, there's no other way to describe it. Just goofing around, just playing around on the chair, just kind of like laughing. And finally, he said, "No pain, no pain, no pain, no pain." And the mother was looking at him, and she's like, the mother was like so irritated that why was our son misbehaving in the doctor's office? And that's when it hit me that even though the child had not been having crisis, or there was no real outside appearance of improvement, the child who had been living with all this pain and throughout without the crisis had been living with all this pain now did not have the pain anymore. So what that tells me is that there are lots of kids, maybe they have crisis once a month, or maybe have crisis twice a year, or 3 years, or 3 times a year. So it's a lot more, it's a lot less severe than the average person, the other kids who have like every week, like you described. But many of them are living with this grinding under the surface pain that they're living with day in, day out, in addition to the fatigue and the other problems that sickle cell warriors have to live with. So that was a really eye opener. That was a real eye opener for me.
The same way they give patients with HIV those their free antiretroviral drugs and the PrEP they give to them. Yeah, I think if it's possible to even give this folic acid, like if it was possible for government hospitals, for government to be giving that folic acid for at least those ones, and maybe reduce. I know most times they max out the health insurance because they always visit the hospital, or most times.
Yeah.
So I understand. But some of these, they are drugs that some people cannot afford these drugs. Talking to a patient, I strolled into one village some weeks back. I just strolled in. And first person I met actually had sickle cell. So they also giving anti-malaria too. As I always, they just so and now after I explained, they said they didn't in their words, they just said we never even see money for food, talk much come they buy medicine. So where can these people get drugs for, get money to purchase folic acid and they even histamine, let's say histamine, because some of them their PCV is really, really low, even below the steady PCV.
Yeah.
So if it's possible for, I don't know, but it's possible to make these things reachable even to the public those public health centers, those PHCs, make it available, put those drugs there so that those people in the rural areas can also get them free of charge or something that costs almost nothing. Because most of them
So
in the rural areas, they can't even afford these drugs.
yeah. So we're talking about histamine, folic acid, anti-malarials, what else?
Yeah, anti-malaria, this drug, at least for these ones, and maybe some painkillers that are some analgesics that probably diclofenac potassium, those ones that don't have that won't disturb people with PUD.
Peptic ulcer
Yeah,
disease, right? Right. Yeah.
yeah. So those ones,
Yeah.
so that it will, those ones can handle the pains when they are really in serious pain. Someone who is in serious pains doesn't need to start taking folic acid at that. They need something that will stop the pain at that point.
Exactly.
And
Exactly.
maybe educate some of those people too at those public health centers that these guys, they can also maybe give them penta if needed. Because most times when these people know that, like my friend I talked to you about, she knows that penta is like all those diclofenac, all those ones, they don't work for her. So what she tells them whenever she comes to the hospital, give penta. And most of the
Pentazocine.
time, pentazocine, yes. But they don't
Okay.
want to. So they'll be like, no, 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 we don't want to get. No, these people are not taking this drug for addiction. It's not for what's the English again. They're not taking it to feel all right. Or they want to the pain, they want to stop the pain at that point. So if
Right.
these health workers, they are also trained that sickle cell patients also need this penta. It's not for what's the English when people want to get high. Ecstasy, it's not for ecstasy. It's for treatment, it's for pain. They can, because most times these people, some of them who have actually read stuff online, or they will see, okay, I spent or who already know, but they cannot afford. Then they can go to the hospital and say they want penta, and the nurses or the person insist that they will not give penta. This is what stops some of them. Diclofenac doesn't work for them. I have a lot of them when I was in the hospital. Oh, you give diclofenac, sometimes you have diclofenac and penta into the, we alternate and give so that the pain will subside. That pentazocine, that's what they have side effect, but it works very well for a lot of them. So if it's going to be possible for them to also educate health workers, even some of maybe the nurses or the people in the public health center, that this penta can also be there. Not every time you give them, but most time when they come with this pain, excruciating pain, and you know this person is sickle cell, give that penta. Not giving, you give patient like I give patient, the person is not recovering. You keep increasing dosage, and this person has ulcer. It's causing more harm than good. And this ulcer now is triggering the crisis again.
Right. Right.
Yes.
Right.
So most of them don't really need this. What they need is to stop the pain at that moment. Look for a way and crash the pain.
Right. So doctors and healthcare professionals need to be educated. As we were talking, I'm thinking maybe there should be some kind of card or pass that sickle cell warriors will have that says, please give this person pain relief, a strong pain relief to handle his sickle cell, so they don't think that he's just having drug seeking behavior.
Exactly. That's why those public health centers, those people around there should. I'm talking about people that I'm actually don't talking about people that cannot afford for now. Some of those people that can afford, some of them are a bit non-legible when they can go to some private hospitals and
Right.
doctors, or maybe they have a hematologist, or those ones that have, like, I'm talking about the primary health center that has these small places in the villages that are just that closes by 5. All those small hospitals, not like hospitals, but public health centers. You understand what I'm saying? Sir?
Yep.
Those places,
I agree.
if you can go there and register. Like if you know your child has sickle cell, take your children also to register. So whenever they come or something, they'll be attended to and given, if it's their routine drugs, at least give them the routine drugs, let them be taking, so they won't even be falling sick always. And also have a sickle cell clinic when you can also tell this, educate them on see what to do. Okay, give them the floor, tell them, let them ask questions. Does this thing, like whenever we're having our clinic now, and our clinic this, I allow them. Sometimes I bring, if there are a lot of them, I just bring them together. Okay, ask your question. What do you know about sickle cell? What have you heard about sickle cell? I want to hear. I make it an interactive session most times in the clinic, especially in the Guse clinic. I bring them to the office. Explain, tell me, ask everybody, tell me what you know. Explain to me what you've heard about sickle cell. I want to hear. So something like that, make it so everybody hears. Oh, if they, most of them hear that when the child gets to so he will die. So explain to them, make them remove that belief, that disregard that belief system. So explain to them sickle cell, tell them what to do and what. Then you should leave the floor for them. They should ask questions. What they think, like whatever is confusing for them, they should ask. That's why you help to be a professional. Answer them. If you don't know, tell them to come back for the next clinic. Maybe someone will be there to explain to them.
So, what are some of the? And that's great that I think it's great that you ask them to open up so you can find out where their misconceptions are and where their false beliefs are. But out of curiosity, what are some of the greatest misconceptions you've seen with these kids and parents about sickle cell disease?
Or most times, some of them, yeah. When I'm seeing sickle cell patients, so I do physical examination to check their spleen, because a lot of them, they've gone to somewhere already. They've already done. There's some marks I see on their spleen. They already done some razor. The person say Baba wants to remove the thing that's swelling or the evil spirit. The last one I said the evil spirit. I don't know if evil spirit resides in the spleen. so most I also tell them don't listen to anybody that tells you we have one Baba that can cure this thing or that will move you from there. Don't go to anybody that will inflict and just go listen to whatever. Take your drug. Vitamin C important, D3 and zinc very very important. The folic acid.
Well, only if they do certain things. I mean, the sad truth is that without good support, unfortunately, many of them will not make it, and that's what we're trying to fight against. Approach, if we're to do one thing, is to help, is to make it so that parents and healthcare professionals provide these kids and the individuals with these basic things. Find a way to provide. If the government can help, that would be great too. But these things are actually available, and making them as, including them in prescriptions, including them as routine drugs, can, I believe, significantly help strengthen their bodies, their brains and bodies, so that they can live longer, healthier lives. I'm not saying is the only solution, but I believe it's a good start. It's a good foundation upon which we can build other solutions. And I know that there are other treatments around the world too, like in the US here, we're talking about bone marrow transplants. That's routine now. We're now talking about some more expensive drugs like Oxybitra or Volexor, some of them costing like $10,000 a month.
Wow.
So that's not going to happen in Nigeria. And of course, the big one, which is gene therapy, which costs upwards of $2 million. Wow. So those things are not going to happen. It's not going to happen in Nigeria. That's why we have to look for things that are practical and safe. And that's why I'm grateful we were able to find a solution like this, and that will significantly help. So again, thank you so much, Dr. Clever, for your time, for giving up your heart and your abilities and your expertise to help these kids and their parents with who are living with sickle cell disease.
Thank you very much. Thank you very much for all you do too. It takes a whole lot of bravery and courage.
Well, it's what I always look at it this way: if you know that something that can help people and you don't do anything about it, you just keep it to yourself, well, you're going to have to answer to God. And we don't want to be in trouble with the big guy. So I'm going to wrap it up here. Folks, thank you for joining us today, and God bless. You can watch these videos on our YouTube channel, and please be sure to follow us on all social media platforms. You can follow me, Dr. David Ajibade, on all the social media platforms. You can follow the Brain and Body Foundation too on all the social media platforms. Till we see you again next week, God bless. Take care. Bye.